The Medical Research Institute of Sri Lanka issued WHO standard recommendations once for the general public on coronavirus. The coronavirus that was first reported in the Chinese city of Wuhan has now spread to USA, France, Nepal, Thailand, Japan, North Korea, Taiwan, Singapore, Vietnam, Malaysia, Australia, and India. In China, 41 people have died and 1,287 cases have been recorded on the mainland. Chinese President Xi Jinping held a special government meeting today to warn that the spread of the deadly coronavirus is accelerating. Foreign media reported that from Sunday, private vehicles will be banned from the central districts of Wuhan, the source of the outbreak. Meanwhile, a doctor treating victims infected with the coronavirus in the Chinese city of Wuhan has died from the virus amid further signs that the local health system has been overwhelmed and that the outbreak is worsening. However, the Shanghai Municipal Health Commission has confirmed that a patient infected with the deadly coronavirus has for the first time since the outbreak been cured and discharged from hospital. After 6 days, the patient, a 56-year-old woman identified only as Chen, showed a significant improvement in her respiratory symptoms. Meanwhile, Sri Lanka's Ministry of Foreign Relations said the Embassy of Sri Lanka in Beijing is in consultation with them and the Ministry of Foreign Affairs of China to provide necessary advice to Sri Lankan students residing in Wuhan to protect them from the deadly infection. The embassy is also in close consultation with the Beijing-based foreign embassies with regard to the course of action being taken about their citizens in Wuhan. In the event of a necessity of evacuation, the embassy, in consultation with the Ministry of Foreign Relations in Colombo, are making preparations for the students and their family members numbering 30. Director of Health Services, Dr. Anil Jayasinghe said there had been no cases of coronavirus reported in Sri Lanka. However, there is a large number of Chinese nationals who had left to China from Sri Lanka for the Chinese New Year. What measures have been taken to prevent the coronavirus from spreading to Sri Lanka?
There is a program currently in place at the Katunayake International Airport to detect individuals with symptoms of the coronavirus. The setup at the airport also includes thermal scanning facilities. All equipment and facilities required to ensure the safety of patients and medical staff have been arranged. It's best if airport staff use a face cover. We have informed the airport's health unit in this regard. This scanner only detects individuals with high body temperature. It does not identify whether the individual is diagnosed with any sickness.
Meanwhile, Sri Lanka's health ministry has urged Sri Lankans to follow precautionary measures when touring China.
You do not have to worry about visiting countries that have confirmed cases of coronavirus. However, you must follow precautionary measures, such as refraining from visiting crowded places. You must always keep your hands clean, wash them with soap, use a tissue or handkerchief to wipe your nose. Refrain from socializing with individuals who have fever or cough. Those who have difficulty in breathing, who have a cold or fever, must receive treatment immediately.
Meanwhile, 2 people, including a Chinese woman, have been admitted to the infectious diseases hospital on suspicion they were infected by the coronavirus. Samples have been sent to the Medical Research Institute.